Hello, I'm Tylah Tully, and today I'm joined by Massachusetts General Hospital reconstructive surgeon, Harvard professor, and US Navy Captain Ian Valerio. He's a consultant and key opinion leader for Orthocell, which received US FDA approval in April for its flagship nerve repair product, Remplir. Captain Valerio, thanks for being here today.
My pleasure.
So, can you start by telling us what brings you to Australia?
Sure. So this is my first time actually to Australia, and what brings me here is an educational program that's with Western Australia University, as well as a program in Melbourne where we're going to talk about different options for reconstruction of nerve injuries, as well as other soft tissue regenerative surgeries. It's my first time here, which has been a pleasure here to meet some of the Australian peoples.
And you're a big advocate of Orthocell and Remplir. Can you tell us why?
Yeah, I think obviously this is a breakthrough technology that will allow for better integration within the soft tissues of the human. Those people that suffer nerve injuries, especially nerve injuries to the epineurium or the outer covering in nerves, it's an important thing to help for nerve regeneration. And the Remplir device actually allows for the reestablishment of the epineurium that's been injured in nerves. And more importantly, will allow for directed growth or regeneration of nerve after a nerve is injured. So I think there's benefit. But not only for that, I think it's also breakthrough technology that will expand more beyond nerve alone and may also help with other soft tissue injuries as well. So I think it's exciting technology as well as breakthrough technology that will be rapidly incorporated throughout the globe, hopefully.
So, what differentiates Remplir from other nerve repair products on the market?
Yeah, so as we discussed here, it has to do with the way that they process their collagen matrix and how they extract it from the porcine or pig model. So what they do is through their process of denaturing as well as removing the cellular components of this xenograft or this biologic material that's from a pig, they actually allow for a purified collagen matrix that actually maintains a lot of its structure that is very similar to that of a human. And because of that, the human actually adopts it as its own tissues and actually identifies it more like itself. So therefore allows for rapid incorporation, rapid recellularization and revascularization by the human. And then more importantly, will allow for better nerve regeneration or other tissue regeneration, depending on where you utilize it in the body.
And what opportunity do you see for Orthocell and Remplir globally and in the US, which is the world's largest nerve repair market?
Yeah, so as you know, Orthocell as well as the Remplir device started in Australia, and it's already been actually utilized in the Australian markets for a while now for nerve repair. And this technology, which is a breakthrough technology, has been used for other soft tissue applications. So with their early work that they've done there in that country, it's now expanded and gotten and received FDA approval in America. And because of that, it's going to open our markets up for the use of this device or this tool for nerve reconstructive surgery throughout the U.S. I think from there, if we show a lot of good clinical trials as well as other type of research that we're going to do over the upcoming years, I think that will definitely not only position as a market leader within the nerve repair and other soft tissue regenerative space, but also within regenerative surgery throughout the world or globe. I think we'll see rapid expansion to other markets. So it's quite exciting, the technology, and I think there's a lot of benefit, of course, from the early work that we've seen.
Finally, can you give us a brief overview of the nerve repair market and how Remplir is positioned within that market?
Yeah, so obviously the world or the market of peripheral nerve injuries, they spans any type of nerve that exits that of the skull or the spine, for example, is quite a large market. And there's a lot of reasons that we see injuries to nerve, whether it be trauma, car accidents, accidents from sharp instruments such as knives, chainsaws, or other type of instruments, to even more severe injuries from gunshots and or blast-related trauma that we see in the States. What happens is oftentimes we require a lot of soft tissue augmentation and or in addition to repair of nerves, also augmenting the nerve repair to allow for it to actually regenerate much more favorably. And we do that by this technology that acts as a wrap and or a connector for certain type of injuries. And by allowing this product to enter the markets, what it's going to do is it's going to allow for patients to more rapidly incorporate this tissue, allow for the nerve to regenerate and actually return to its home, either sensory and or motor components, and ideally help with the reparative process so you get better outcomes for nerve injuries, whether it be from any of the traumatic injuries, oncologic or congenital type of issues in the peripheral nerve space.
Well, thank you so much for your time today, Captain, and we hope you enjoy the rest of your time in Australia.
Now, my pleasure, and same to you, and nice meeting you.